Thank you. We want to go now to the Surgeon General, Vice Admiral Jerome Adams. The doctor joins us this morning from Wolcottville, Indiana. Good morning to you.
Well, good morning, Margaret. I wish I was here under different circumstances because, as you mentioned, case counts are going up in many localities, and we are absolutely concerned about that. But there are two very important things that I just want the American people to know. Number one, we are in a very different place than what we were in February and March. We have an over 300% increase in available PPE, and that's not to say mission accomplished, but we are in a better place. We have remdesivir, steroids, convalescent plasma, all which mean that if you actually get diagnosed with COVID, your chance of dying from it is significantly lower than what it was in February and March. And that's important for the American people to know. The other really quick thing that I just want people to know is that
I would like to get to some questions.
The disease course is only about Yes, absolutely. This is an important point, though. The disease course is about 2 weeks. So while we're seeing cases rise, we can see cases go down just as quickly if the American people will do the things that we know slow the spread of this disease, including wearing a face covering. Critically important for people to know COVID stops with me. We have the power to turn this thing around.
Okay, let's start there then, because you are wearing a mask. You are clearly trying to make a point. At the beginning of April is when the administration started telling the public to wear masks. But just the last time you were with us here on Face the Nation, March 8th, you said this. Let's listen.
And stay safe by washing your hands, by covering your cough, by staying home if you're sick. Masks do not work for the general public in preventing them from getting coronavirus.
Right. And the week before that, you tweeted in all caps, "Seriously, people, stop buying masks." You said they were not effective. Do you regret saying that?
Well, it's important for people to understand that once upon a time, we prescribed cigarettes for asthmatics and leeches and cocaine and heroin for people as medical treatments. When we learn better, we do better. And the WHO,
Are you saying at that time you did not know because the CDC in February was looking at asymptomatic transmission of the virus?
We were looking at that, but the CDC, the WHO, and even in May, there was a New England Journal of Medicine article that still disputed whether or not masks were effective. We've learned more about asymptomatic spread. Up to 50% of people who can spread this disease spread it without having symptoms. And that's why the American people need to know that science is about giving the best recommendations you can. And when you learn more, you change those recommendations. Our recommendations have changed. Now, people of America, important to know you should wear a face covering.
And we certainly do.
When out in public.
We certainly do take that advice, but I think you have to acknowledge that this mixed messaging has created confusion, and it has drawn into question some of the credibility of the administration. Are you certain
that
this wasn't just done because of a shortage? Well, I'd like you to clarify it. Were you saying that then because there just wasn't enough equipment?
I was saying that then because everything we knew about coronaviruses before that point told us that people were not likely to spread when they were asymptomatic. So the science at the time suggested that there was not a high degree of asymptomatic spread. We learned more. There also was, as you mentioned, the very real concern about hoarding of PPE and people dressing up in trash bags as healthcare workers. That was a part of it, but the primary reason was because that's what the science said. And I want the American people to understand we follow the science, and when we learn more, our recommendations change. But it's hard when people are continuing to talk about things from 3-4 months ago. I've said consistently for the past 3 months, ad nauseum on the internet and in interviews, wear a face covering. It helps slow asymptomatic spread. It will help us reopen churches and schools and have prom next year and have football in the fall.
Right, which is why I think leveling with the public is important. I want to also get to something very specific in terms of what the CDC has revealed this week, and that is, in particular, Hispanics and Black Americans are 3 times more likely to get the virus. They are twice as likely to die from it than Caucasians are. You said a few days ago that one of the reasons that you had questions about mandating masks is because you said in the context of the Black Lives Matter movement, you worry about having a situation where you're giving people one more reason to arrest a black man. To be very clear, are you saying that racism makes it too risky to mandate masks, and Black Americans, you are also prescribing for them wearing masks now?
So to be very clear, I am not saying it makes it too risky. I'm saying that if we're going to have a mask mandate, we need to understand that works best at the local and state level along with education. We need people to understand why they're doing it, and we need people to understand how they benefit from it. Because if we just try to mandate it, you have to have an enforcement mechanism. And we're in the midst of a moment when over-policing has caused many different individuals to be killed for very minor offenses. And that is an important consideration. As Surgeon General, I want people to understand why they should wear a face covering. And they're going to be more likely to do it. They're going to be more likely to do it willingly. And they're going to be more likely to do it when we're not watching, which is important.
I want to ask you about where we are as a country right now. In Texas and Arizona, there are reports of refrigerator trucks being ordered because morgues are about to be overwhelmed. The two senators from Texas are requesting a field hospital be set up because of concerns about overcrowding. This morning, the Republican head of the National Governors Association said there should have been a national testing strategy, and now this thing is out of control. Does the administration have this under control?
Well, what I will tell you is that we're in a very different place than what we were in February. We are much better able to respond. We've sent out 10 teams to the most problematic areas, and we have another 9 going out this week to help with staffing, to help with testing. We do have a national testing strategy, and we're working with states to give them all the supplies that they actually ask for. So again, please don't mistake me for saying that we are happy with where we are. Please don't mistake me for saying we're happy with where we are. What I'm saying is that we are working with states to make sure we can respond to this incredibly contagious disease. And part of that, again, is making sure we're slowing the spread by helping people understand the importance of wearing face coverings and good hand hygiene and staying home when they can.
Understood. But I think, you know, the administration has talked about this tension between reopening the economy and dealing with the virus. The pain that people felt and took to their pocketbooks on the East Coast and the west of this country when they shut down the economy, they were told that was to mitigate the spread. They were told that was so people could get ready for another round of this virus. But right now, what we're hearing sounds like what we saw in April. Shortages of PPE, waiting times for test results. What happened? And who's in charge of fixing that?
Well, I think it's a little bit unfair to say that this is exactly what happened in March or April. Again, a 300% increase in personal protective equipment. We're doing a much better job of protecting the vulnerable. It's why you've seen the age of cases being diagnosed drop by over a decade and a half, a much lower fatality rate.
The CDC director said this week that more testing needs to be done. So the administration, health officials are acknowledging that.
We are doing 600, 700,000 tests per day, and I will agree with you that in certain areas we do need to do more testing, and that's why we have these strike teams, multidisciplinary teams of health experts going to the problem areas. The other thing to understand is if you look at Arizona, for instance, Arizona as a state is steady. But when you look at Phoenix area, Maricopa County, that's increasing. These increases that you're hearing are very regional, and so we have a very targeted approach to make sure we're getting the resources to the people that need it the most, so that, again, we don't see the fatality that we saw in March and April, which Tony Fauci, Dr. Redfield, myself, no one in the task force wants to see that, and we don't think we're going to see that because we're better prepared to respond, but it's got to be coupled with prevention. And I know I keep harping on that, but we have the power to slow the spread. I would ask you to share my PSA, hashtag COVID stops with me, on my website, because together we can turn this thing around in just 2 to 3 weeks if everyone does their part. More studies coming out showing the effectiveness of face coverings.
2 to 3 weeks for what exactly?
The disease course is about 2 to 3 weeks. So just as we've seen cases skyrocket, we can turn this thing around in 2 to 3 weeks if we can get a critical mass of people wearing face coverings, practicing at least 6 feet of social distancing, doing the things that we know are effective. And it's important for the American people to understand when we're talking about the fall, we have the ability to turn this around very quickly if people will do the right thing.
And I think everyone in America wants you to turn this around and wishes you the best of luck in doing that. But a lot of American parents are very worried about sending their children back into classrooms in the middle of increasing cases in hot spots. in large parts of this country. The president said this week that the CDC guidelines on schools are very tough and expensive. They're asking schools to do very impractical things. The CDC guidelines say use hand sanitizer with 60% alcohol, put up barriers between desks, to have kids 6 feet apart. What part of this is too tough and too expensive?
Well, thank you for that question. I have a 16, a 14, and a 10-year-old, and I want them back in school. We know that kids who are not in school are more likely to be obese, to misuse substances. There's less reporting of sexual abuse and of child abuse. There are real health implications to not being in school, but it has to be done safely. And
right.
The CDC guidelines that are out talk about best case scenarios, and I'll give you a very specific example. They say that every kid should bring in their own lunch. So you asked for a specific example. We know that in some school districts, in many school districts, over 50% of kids are eating lunch at school and don't have the ability to bring their own lunch. So that's one case where we need to work directly with local school districts and help them figure out, okay, if you can't do what is the gold standard best case scenario, can you do something that's a compromise to safely reopen? That's what we're talking about when we talk about issuing new, more specific recommendations that we can look at school district by school district.
And we'll get those
not everyone can do the gold standard. My understanding is the CDC will get those out. And I know they're working with individual school districts. I actually am here talking this morning with my sister-in-law, who's a principal at a local school here, and they've got a plan. That's what's important for each district, to have a plan to figure out how to do this safely.
Right, and I think there's a lot of looking for a national plan. Doctor, we wish you well. Thank you very much for your insight.